Hi, my name is Dr. Ilya Skolnikov. I'm coming to you here from Triad of Health Fertility Clinic in San Rafael, California. There's a lot of options when it comes to getting pregnant. If you're having trouble getting pregnant, you wanna know what your options are. So some people will end up pursuing stem cell procedures where they can get injected with stem cells that help them to have a healthy uterus and healthy ovaries and healthy eggs that allow them to carry out a healthy pregnancy. Other people will choose to get injections from a fertility clinic. Again, to me, those things don't make a lot of sense. They don't make a lot of sense because what's the thing that's causing the person not to get pregnant to begin with? The women that we've treated in our office have had a lot of trouble getting pregnant because they just haven't been that healthy. Most of the times they have dysfunctional thyroids, and so if the person has an unhealthy thyroid, the thyroid regulates hormones in the body. So if there's an unhealthy thyroid, then unhealthy ability to get pregnant. In other words, it's hard to get pregnant. Maybe they get pregnant, but they can't carry out a pregnancy because the progesterone levels never go up high enough towards the end of the 28-day cycle after the egg has been impregnated. So they might be able to get pregnant but not carry out a healthy pregnancy if their levels of estrogen go up properly at the beginning of their cycle, but then the progesterone levels don't rise later. Follicle stimulating hormone is what leads to the rise of estrogen, and luteinizing hormone is what leads to the rise in progesterone. So this is kind of like, having a healthy cycle 101, right? So it's not that these clinics that use the stem cells or inject you with hormones don't understand the science. They do. There's medical doctors there who are incredibly well educated. The problem is they're not thinking clearly about what is involved with getting pregnant. Like, common sense would have you think, hey, if the person can't get pregnant easily already, something's seriously wrong, so we should probably find out what the thing that's wrong is, right? In other words, I would imagine, to me it makes sense to find out why they can't get pregnant. So not just to start injecting them with hormones or giving them stem cells or treating symptoms, but to address the causes of symptoms. The causes of symptoms, I promise you, have something to do with the ovaries, they have something to do with the uterus, and they may have something to do with the male, the man then, right? So you got to find out what the problem is. You got to diagnose first. You got to diagnose first, and then you treat. So you diagnose the need for a particular therapy, you supply the need for the therapy, and then you observe the results. So I could talk on and on and on about my experiences and how I used to have hormonal imbalances, which is true, even though I'm a male. Both men and women have female hormones. It's just that men have more male hormones than female hormones, and women tend to have more female hormones than male hormones. But when men end up having more female hormones than male hormones, they end up with andropause. And when women have more male hormones than female hormones, they have the famous menopausal symptoms. Menopause, they actually had a play. I don't know if you heard about this, but there was a Broadway play called Menopause a couple years ago. I never saw it, but I thought that was kind of cute. Okay, so let's just kind of cut to the chase a little bit. We can help you. Almost undoubtedly, we can help you with your chances of getting pregnant if you're having trouble getting pregnant. You don't have to play the Kaiser game. You don't have to play the whatever game you've been playing with your healthcare insurance and the healthcare providers that they've referred you to, because the game is the thing that led you to see this particular little video that you're watching. We can help you. So rather than me going on and on and on about how wonderful I am and how great our clinic is, which is true that we are, and we provide therapies to help. We have an infinite number of therapies. So I guess I am telling you about how wonderful our clinic is and how great our therapies are. That's what I'm doing right now. So our clinic is great and our therapies are wonderful. Why? Because we have therapies to help. We don't just use surgeries or radiation or chemotherapy or stem cells or inject you with hormones. We actually do what Hippocrates said over 2,500 years ago. Sounds like I'm part of a special sect, a special group of people. But yeah, so 2,500 years ago, Hippocrates said, the highest good is to find the cause. And what did he mean? He meant you need to diagnose what the problem is. So in other words, if you're just getting treated, having your symptoms treated, it won't really work. So you got to diagnose the cause, okay? Okay, so we have naturopathic therapies. Part of our exam is a naturopathic exam. We have herbal therapies. Part of our initial intake is to evaluate what herbs might be helpful to you in helping you to get pregnant. Instead of telling you to just avoid certain herbs because they're going to interfere with the pregnancy, we want to know what herbs are going to help you get pregnant. For example, blue cohosh is an excellent herb to help with pregnancy. Excellent herb. Just as an example. Not that you need blue cohosh or that you should just take it without a healthcare provider's supervision, but I just thought I'd let you know that it just happens to be a great herb for getting pregnant. Okay. So we do the chiropractic exam, we do the neurologic evaluation and exam, we do the orthopedic evaluation and exam, we do the functional blood pressure testing. We check your blood pressure differently. We check your blood pressure in 3 different postural positions. We check it seated twice, standing twice, and lying down twice, because the blood pressure should raise a certain amount going from seated to standing, and it should go down a certain amount going from standing to lying down. And if it doesn't, that indicates certain imbalances with the glands and organs, specifically the adrenal glands, the heart, the liver, the kidneys, and a person's emotional state, not to mention their hypothalamic, pituitary, thyroid, adrenal axis. If you want to look that up on the internet, check it out, look it up. Hypothalamic, pituitary, adrenal axis. One of the most important things for getting pregnant and carrying out a healthy pregnancy, if not the most important thing, is the balance and health of the hypothalamic, pituitary, adrenal, thyroid axis. Okay, I hope you like that word. Okay, all right. So yeah, I think that's about it. So let's get in touch. Let's help you. Let's stop going through this craziness of talking to people with lots of skills and training, but only in an area that may not help you with your overall health and carrying out a healthy pregnancy. Because if you go to the fertility clinic and you get pregnant, and then you have a child that's really sick as a dog, like with asthma and all kinds of troubles, that might not be worth it, right? I mean, yeah, you got pregnant, but the whole idea is to get pregnant and then to carry out a healthy pregnancy. So if you've been having trouble getting pregnant, and especially if you've been having trouble getting pregnant and you already are consciously aware of having some difficulties with your thyroid gland, now's the time to get the thyroid gland healthy, get pregnant, and carry out a healthy pregnancy. Again, this has been Dr. Ilya Skolnikov from Triad of Health Fertility Clinic. I'm really, really excited to have brought you this information, and we look forward to seeing you soon and helping you out with your fertility.